Welcome, my friends. I'm Bob Schrupp, helping you towards your goals of becoming healthy, wealthy, and wise within your own home. It's really kind of cool. Today we're going to talk about vertigo. Vertigo is that spinning sensation that you may get. And in this case, I'm talking about that spinning sensation that is probably somewhat short-lived, maybe a minute or two. Certainly not 15 minutes or 30 minutes or continuous. In that case, you definitely need to see your doctor. In fact, I would recommend that you see your doctor even in this case, to get it confirmed that what you probably have is benign paroxysmal positional vertigo. And I'm going to put this chart up here so you can see it right at the top there, benign paroxysmal positional vertigo. What that is an involvement of your inner ear. And there's some canals that are in there, and you've got some debris or otoconia or stones, whatever you want to call them, crystals, and they're in the wrong place, and we need to get them in the right place. The good thing about having BPPV, benign paroxysmal positional vertigo, is that it's very treatable. The bad thing is that you don't know necessarily which treatment to do. Now, most of you are going to be doing the Epley maneuver. Let me show you on this chart here too. The Epley maneuver, which is also called the canalith repositioning treatment. Now, that's the problem with this thing, is when you got vertigo, there's at least 6 treatments you can do if it's the short-lived type that we were just talking about. So I'm going to tell you, based upon what symptoms you're having, this is the thought process the doctor's going to go through, or your physical therapist. Based upon what symptoms you have, what treatment should you try? Most of you are going to do the Epley maneuver. Most of you do the CRT or the canalith repositioning treatment. They're the same thing, the Epley maneuver and the CRT. But some of you, if you're not having luck, you're going to have to do the liberatory method or the barbecue roll. This sounds crazy, doesn't it? It sounds like some weird names, but we'll go through it and make it clear in all cases. For those of you who may be in the professional field, if you're wondering what my resource is, I'm using Vestibular Rehab, the 3rd edition. This is by Susan Herdman. She's a physical therapist and a PhD, and she's got some other long initials after her name. So, let's start off with, basically, again, you've been diagnosed with BPPV. You have spinning sensation that is brought on generally by you turning into a specific direction, maybe rolling to a direction or turning to a different direction. If you have symptoms that are brought on by going to the right, and those symptoms, again, the dizziness or the spinning, last for less than a minute, then you're going to do the Epley maneuver to the right. So there it is, the Epley maneuver, symptoms to the right, you're going to do it to the right. If you look on my website, I demonstrate how to do that. If you have symptoms, you're going to the right, and the symptoms last, the dizziness lasts more than a minute. Now again, I'm not talking about 15 minutes, I'm talking about a couple minutes. Then I want you to do the liberatory method. And you can do the liberatory method to the right. Very simple. Let's say you have symptoms going to the left. By the way, let me interject here real quick too. In all cases, if you have difficulty with your neck, let's say you have rheumatoid arthritis or a neck fusion, you're going to have very difficult doing these maneuvers, and you shouldn't be doing them. I think I repeat this in most of the videos when I show you how to do these techniques. But there's other ways that therapists can do it, or medical centers can do it, so don't be worried. There's an alternative. But right now, you can't be doing those. All right, so you have symptoms to the left. You turn to the left, you roll to the left, you get spinning. In that case, if it's less than a minute, again, you're going to do the most common treatment, which is the Epley maneuver or the canalith repositioning treatment. If, again, you go to the left and the symptoms last a little more than a minute or two, in that instance, you're going to do the liberatory method to the left. Look for these. These are on my channel. Just look for the name, liberatory to the left, liberatory to the right, or Epley to the right, Epley to the left. If you have symptoms in both directions, let's say you go both ways, and maybe not even spinning, but maybe your eyes get a little herky-jerky both ways, in that instance, the debris may be in what we call the horizontal canal. In that case, you're going to want to do the barbecue roll. The problem with this one is that I can't tell you which direction to do it, because we determine which direction we're going to do it based upon which way your eyes are moving, and that's something you're just not going to be able to determine. Now you could try the barbecue roll into both directions and see if one helps. I guess I'd have no trouble with that as an effort, but basically that's the 5th and 6th alternatives for treatments. Again, we got 6 treatments for BPPV, and those are the 5th and 6th one. One would be to the right, one would be to the left, and I do have those on my website or my channel too, that I'm showing you how to do the barbecue to the right, barbecue to the left. There are some other treatments for vertigo. These, according to the book, according to this vestibular rehabilitation, these are probably the best alternatives. So why give you all these other ones when these are probably the best. Good luck to you, and I hope you can subscribe to me. I'm going to be giving you a lot of information on how to stay healthy, wealthy, and wise.